Hello everybody, it's Miriam. I'm at Rise Up Aesthetics and Wellness. I am the nurse practitioner here. Today I'm going to discuss the route of administration for testosterone replacement therapy. I'm going to review some of the pros and cons and what is the best way for you to know which one is the best one for you. Okay, so let's begin. The first one that I'm going to talk to you about is, of course, the injectable. So testosterone can be injected in two ways. It can be injected intramuscular or subcutaneous. So if you do not like needles, this is not the best route for you. There's also a difference in the needle if it's muscular or subcutaneous, and I'll show you the needles because there's a big difference. So if you don't like needles and are dreading receiving that weekly or bi-weekly injection, subcutaneous might be a better option for you. Just know that the effectiveness of an intramuscular injection is better depending on the formulation. But anyhow, so let me show you the needle here. So for a muscular injection, it does have to go deeper, of course, because it's into the muscle. And so this is a needle, okay? Let's see, it's about the size here of, there you have it. Okay, so that's for intramuscular. Second option for injecting testosterone is using an insulin syringe or the Easy Touch. There's different brands, but anyhow, so this is subcutaneous, so the needle does not have to be as big as the intramuscular needle. So let me show you this one, and it's a huge difference. See, it's barely the tip of my finger. So this can be an option if you are scared of needles, don't like them. I don't like them either, but I put up with it, but I don't like them. Anyhow, so those are the pros and cons of injectable testosterone. Okay, so moving on to the next one, and yes, I'm looking at my notes. I can't remember everything. The second one is topical testosterone. So this comes either in a cream or a gel. The pros is that, of course, it's needleless. It's not painful. It's easily absorbed. The downfalls to the creams and the gels is that when you apply it, you have to be careful. If you have children, not to hug them. Depending on where you apply it, it can be transferred to somebody else via the skin. So if you say you put it on your arm, you go and hug your child, it can be transferred to your child. So this is something that you need to think about, although you can put it in places like your abdomen, your inner thigh, just in places where you won't have that contact, right? So those are the pros and cons to the gel and the ointments. I did forget, because you're applying it to your skin, some people might have some irritation to the site, depending on what is in the gel or the cream. You might be a little bit sensitive to it. You might have to try different ones, maybe from different pharmacies, to see which one works for you. But again, this is for the testosterone cream or gel. All right, so moving on to the third one, patches, testosterone patches. This is great because it's, you just put on the patch and that's it. You forget about it. You don't have to worry about it being transferred to somebody. You don't have to worry about it being painful. So it's easy, it's convenient. The only thing is, it's not the cheapest, depending on where you get it. You might want to talk to your provider about the options for that. but it's pretty easy. Put it on there and you forget about it. Let's see what else. Okay, so again, because it's being applied to the skin, you might have some irritation to the site of where you apply the patch. Again, you can try different patches, different pharmacies, depending on where you get it from. But this is an option for those that don't like needles. Again, this is the testosterone patch. Moving on to the fourth option, testosterone pellets. Okay, so the pros to this is that it lasts long. It lasts anywhere between 3 and 6 months, depending, your levels and depending if you're a female or male. So there's a lot of different things that this is dependent on, but for the most part is between 3 and 6 months. The other thing is that the testosterone pellet, when it's inserted, it slowly releases testosterone, depending on the pellet, because there's some pellets that do cause that spike in testosterone, and then you have that dip. So do your research, because it does depend on the pellet if you have that steady release of testosterone in a pellet. Make sure you do that research, people. And then the cons. So a pellet does get inserted. For the most part, it's inserted around this area. Sometimes they put it in this area. They surgically incise it with a scalpel. So it's minor surgery, nothing drastic to where you have to be sedated or anything like that. But they do put some local lidocaine to numb the area before they insert the pellet. So that is one of the cons to that. Another con is that the pellet might be, you might have a pellet extrusion, meaning that the pellet might actually come out on its own from your skin. So that is actually provider dependent, and the person that is inserting the pellet and the actual pellets. There are pellets out there that are made to prevent this. So again, do your research and know what pellet brand you're getting inserted in you, okay? Because there's some that prevent this, and they prevent site infection, site irritation. So do your research on the company, the brand of the pellet, and what is in that pellet exactly. How is it made? That makes a difference too. How is it crushed and put into that pellet makes a big difference as well. So that's a major complication. Also, you can form scar tissue in that area. Of course, you can feel it sometimes under your skin. The cost is also a con, just because it can be pricey depending on where you get it. Most of the time, this is not covered by insurance, and you have to pay for it out of pocket. So that's the testosterone pellet. Let me see if there's anything else I forgot. I believe I covered everything on the pellet. Okay, so moving on to the next one, number 5. It is oral testosterone. Okay, so oral testosterone is easy, just depends on the dose, whether you have to take it every day or not. It's non-invasive, of course. You don't have to worry about it being transferred. You don't have to worry about it being, accidentally released from your body. It's non-invasive, no needles, no syringes to worry about, just the pill and take it. Let me show you one. this is an example, one that recently came out. It's called Cassitrex. And this pill comes in 3 different doses. There's 100, 150, and 200 milligram doses. So depending on your level is what your provider would dose you. But this is one of the latest ones, and there you can get it in any of the pharmacies, and also the compound pharmacies have them as well. Like I said, the pros is convenient, it's a pill, non-painful. You don't have to worry about transferring it to somebody else. The cons, okay, so for the pill, you do have to worry about, depending on what pill it is, what pharmacy, the dose and everything, it can be, it can impact your liver. So this is why it's very important for your provider to draw your labs and obtain an overall picture of your labs, testosterone, chemistry panel, everything, because we need to make sure that you're able to metabolize the testosterone pill, basically. If you have some type of liver disease or something like that, this is not the pill for you. Also, it can increase blood pressure. So if you have high blood pressure already, this is something for you to consider, because it can increase your blood pressure. Again, that can happen with some of the other forms, but especially with the pills. So this is something to keep in mind. Let's see. Okay, and also depending on the pill, you might have to take it twice a day. So for some of y'all, it's like you don't want to take another pill again at the end of the day. So but those are the pros and cons on the pill. So okay, so those were 5, and to review the 5 routes of testosterone administration, first you have the injectable, then you have the creams and gels, then you have the patches, the pellets, and the oral testosterone pills. What are the factors to consider when you are trying to choose what route is the best one for you? Of course, lifestyle. What is convenient for you? What best fits your lifestyle? These are very different options, and you have to look at your lifestyle to decide which one is best for you. Comfort with needles. Of course, if you don't like needles, the injectable is not the choice for you. If you have skin issues, eczema, psoriasis, any skin issues, probably most likely the topical, like the gel and the cream, is not for you. So that's also something to consider. Cost, of course, is always something that you need to think about. So looking into the prices of all the different ones, you can discuss that with your provider, and they can provide some feedback to you about the pricing. Effectiveness, this is something trial and error with the different types of routes, just because everybody responds differently to the injection, to the pellet, to the cream. So basically you have to start with one, and if that doesn't work out for you, then talk to your provider and see which one best works for you. So trial and error. You have to have an open communication with your provider. If you cannot, then it's probably time for you to find somebody else also. Not to be harsh about it, but yeah. Also, another thing to consider when choosing which one is the best route for you is health history. Again, like I said, some of these affect your liver, affect your cardiovascular, affect your blood pressure. So do your research, and then that way you can choose which one fits you, your health, and what the outcome that you're wanting from this. Just remember that with TRT, All the routes are different. They all have the benefits and cons to them. You just have to find out what best works for you and your health and your lifestyle and your overall needs, and know that this is not a one size fits all. You have to figure out what works for you and tweak it as you go. So open communication with your provider is a must. Alrighty, I think I covered all the routes. If you have any questions, comments, be sure to like and follow my channel. I'll be discussing other hormones, peptides. If there is something that you're interested in me discussing, go ahead and comment. I can certainly go over some things with you. Again, this channel is for all things aesthetics, wellness, health, hormones. If you have any questions, again, you can reach out to me. My number is 210-651-2211. If you want to schedule a consultation with me, you can go ahead and do that. I do labs and everything. I hope everybody has a good weekend, and see you next time. Bye.